Patient advocates are in a unique position to not only share the data or share an issue like palliative care, but they share their own personal story. And it makes it so much more real when we're sharing what it is we think is going to make a system better. I can tell you that palliative care, for example, reduces needless hospitalization, reduces ICU days, reduces utilization of nursing homes, that it increases a person's ability to stay well and at home. There's a lot of data about it. There's data to suggest you'll live longer if you have palliative care introduced and integrated into your care. That's the data. The evidence supports it. But there's more than data. So I've chosen to focus on treatments that really maintain the quality of my life. My care has a palliative component. It's really focused on keeping me well and functioning. I am a person who lives with stage 4 cancer, and because of that, I'm not going to be cured. It's a rare form of cancer. My prognosis, 11 to 20% survive to 5 years. I'm here talking to you at 3.5 years into my diagnosis. I have inflammatory breast cancer. It's spread to my lower spine. And here I am, and I feel the way that I look. I feel great. I'm doing well. I'm working, and I'm enjoying life. I have everything ahead of me to do, and it's all because palliative care is part of it. Don Berwick talked about something called the triple aim, the 3-part aim: better health, better care, lower cost. I am a walking 3-part aim. I have better health. I'm doing very well. I think you can see that. Doing much better than somebody who would have taken a very aggressive curative approach for a non-curative disease. I do well. I have better care. It's care that includes me in the decision making. It's focused on my goals and values. And better cost. I've saved likely over $1 million to date because I've avoided those things that are most expensive, but to be honest, they would have been meaningless. They would have dropped me off a cliff. I often talk about wanting the Niagara Falls trajectory. I know that sounds kind of silly, but I want to go good, good, good and drop off the cliff. And if I had gone the other approach, I would have dropped off the cliff with immediate, heavy, heavy doses of chemotherapy, radiation, and surgery, and I would have moved out to the same endpoint. So again, I want Niagara Falls, good, 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 drop off the cliff. And instead, I was offered by one provider dropping off the cliff and moving out to that same endpoint. It's really important to understand what palliative care is, and consumer advocates, patient advocates, we can share not only the data, you know what palliative care does around utilization, around cost, and around quality of life, but we share a story. I share a story. And that story is the one that really tells you, okay, $1 million, good life, climbing the Great Wall. I live with cancer. I live well with cancer. This is something that anybody would really want. And I'm not saying they would make the choices that I would make, choosing care that has the least amount of side effects and focusing on quality of life. And by the way, I do get an infusion once a month. I do take medication. Palliative care is not giving up on treatment. I'm actually just doing really, really well. But I didn't do the throw everything at it version of care. I didn't have a mastectomy. The cancer's already spread to my lower spine. One physician wanted to do that. It did not make any sense. It wouldn't get me any better. The cancer is already spread in my body. Those are the kinds of decisions I'm talking about. And palliative care has open and honest dialogue that helps people think about what's the right decision for them. Again, there are no wrong decisions. There are only informed decisions. But this is the role of a patient advocate. We share the data, but we also tell the story. And I hope that I've told you the right story, the story that you're going to enjoy. And I hope you get to live the kind of life that I live. It's been a great life.